Good evening. My name is Sarah. I'm going to be your student nurse practitioner today.
Okay.
I'm going to ask you a few questions, and then I'll go through a physical exam, okay?
Okay.
All right. First, I'm just wondering about your overall basic health that you've had for the past, couple months. Have you had any headaches?
Yes, right now.
Right now?
I have sinus.
Okay. How often does that usually happen?
This winter, a lot.
A lot? Okay. What does the pain feel like? Is it a sharp pressure?
Today was throbbing.
Okay. And then, does it spread anywhere?
I had felt it right in the back of my head really hard today.
Mm-hmm. And then what else happens? Any,
nauseousness.
Okay. And what do you usually do if that happens?
I take a sinus pills.
And
sinus headache pills, Tylenol.
Okay. And
it's inside it.
Does it go away usually?
No, it just takes the edge off of it.
Okay. Have you noticed any changes, in your headache? Has it been, each time getting worse, or is it just, stayed the same?
Oh, no, it's some... Right now, today is worse. It's
okay.
As bad as it gets. But
and how frequent?
Usually it doesn't get this bad. This time I've went through a lot of boxes of sinus pills.
Okay.
I think it has something to do with my teeth, but they say there's no connection, but I think there is, because I'm having problems with my teeth right now, too.
Did that start first?
Yeah, or around the same time.
Okay.
Yeah.
And have you always had, migraine or sinus headaches, since childhood?
Last time I remember having a migraine, I think I was in my 30s.
Okay.
Maybe 40s.
Okay.
But not very often. I don't have it very often.
Any problems with your vision at all?
Yeah, today I felt like my vision was off, flickering lights.
From the headache?
Yeah. So.
Any other, vision problems normally? Do you wear glasses or contacts? You do?
I have reading glasses.
Reading glasses?
I also have, nearsighted, not too strong.
Okay. And when's the last time you had, a vision test? Yeah.
3 years.
Okay. Okay. And you don't need glasses for, every day?
No, I just had a thing for a week ago for my license. They tested my...
Oh, okay. Yeah.
I almost didn't make it, but I made it.
Okay, good. Any double vision or anything like that? I mean, today you said you were having problems.
Double vision. What do you see when you have...
things will be doubled. Let's say you're, looking at... Well,
no.
kind of if you're looking at one object and it kind of has, a shadow or there's two of them. No?
No, I haven't noticed that. It's just, kind of flickering.
Okay. Any excessive, eye watering or tearing?
Yeah, I was doing that today when I first got it.
Okay.
But that's normal.
More sinus feeling?
Yes.
Okay. Any allergies?
I was sick last week for one day. I threw up. I don't know.
Oh, really?
I don't know what the heck that was from.
Okay. But do you have, allergies, to the environment or animals or anything like that?
I think seafood.
Seafood? Okay.
Maybe some seafood.
Okay.
But the one everybody likes.
Shrimp or lobster?
No, another one. No, hopefully salmon.
Salmon, okay.
That one I am allergic to.
Any medication that you're allergic to?
Not that I know of.
Oh. Have you noticed any issues with your hearing at all?
Well, the sinus thing kind of makes my ears feel
hot.
Like they're...
Or
sometimes
harder to hear?
It's blocked.
Okay, yeah. Any ringing in your ears?
Yeah, I have that from time to time.
From time to time. Okay.
Not
does it come and go, or does it stay for a while?
It's, I get for maybe up to 3 days.
Okay. Have you noticed it's attributed with anything?
Sinus.
Okay.
Yeah, it's attributed to sinus.
Okay, good. Any changes with your smell, sense of smell?
No.
Any excessive congestion or nose running?
Yeah, a little bit.
Okay. Is it a clear coming out, or is it...
It's mostly clear.
Okay, good. Let's see. Any nosebleeds at all?
When I had a cold a couple months ago, I was blowing my nose. Blood came.
Okay, was it dripping, or
no,
more
dripping.
of just when you blew it?
Just when I blew it. That's
could be
unusual for me.
Sometimes dry air will do that. If it's not humid enough. Yeah, I don't know. But no nosebleeds at all.
No, nothing that comes down.
Okay. Any problems with a cough at all?
Just when I have a cold. But
Okay.
other
Any
than that, no.
sore throat?
Not really.
No. Okay. Any problem? You said you did have some teeth problems.
Yeah, I have a couple abscess teeth.
Teeth abscess?
Yeah.
Okay. Any jaw pain?
I did it about a week ago.
Okay. Is it when you chew, or do you have, like, teeth grinding?
My dentist says I do grind my teeth, but I'm thinking, why did I have... I think maybe I yawned too big or something. So
Yeah, and, like, tight muscles, kind
yes.
of? Okay. Any painful or swollen lymph nodes that you've noticed, like in your neck or anything?
I don't know. I can't tell.
Okay. I'll check them out. Any excessive sweating at all?
Hot flashes.
Just hot flashes? Okay. Now, have you had any chest pain? No. Any, like, shortness of breath or feeling like you can't catch your breath?
No, I don't think so. Anxiety, maybe.
Okay. And you said no cough, but how about if you do cough, any coughing of blood?
No.
No. It's not very common.
It's not blood.
Now, have you ever felt your heart racing, or have you ever
Yeah.
felt like you could feel your heartbeat?
Oh, yeah.
Yeah?
Yeah. I smoke a cigarette.
Okay.
And then I lay down.
So usually just with a cigarette. Any other times? Like exercise or anything like that?
Yeah. Yeah, I do get
Okay.
fast.
Does it feel like it's just pumping real fast?
Sure.
Yeah. Does it make you dizzy or anything like that?
When I notice that I'm laying down, and right when I lay down after I had my cigarette, then I can feel it. But in 5 minutes, it slows down.
Okay. Okay. Have you noticed any swelling anywhere? Like hands?
Well, I did have problems with my feet, but I figured out what it was.
Okay.
I have the chill lanes, or whatever they call it, where your feet are cold, then you warm them up too quick.
Mm-hmm.
I think I was getting, my bath water was too hot, and I stopped doing that, and I don't have it anymore.
Okay,
but
so your feet were swelling?
it was chill lanes or something.
Okay.
Where I get these red bumps, and the foot would get inflamed and really hot and itchy.
Oh, wow. But you haven't
I've
had that in a
never been
while?
diagnosed, but I read it on the internet.
Okay.
Just a couple weeks ago, I stopped it by, I don't get in the hot water. I don't make the water so
Good.
hot.
It's good for you. I do that too, though.
Yeah.
Turn on the water way too hot.
Yeah, it really makes a difference because you suffer like for 5 days with that. It's really...
Was it hard to walk?
No, but when you sit there mostly at night, and it would be so itchy, sometimes it would wake me up.
Yeah. Did you take anything for it? Any, like, Benadryl? Did you put any cream or anything like that on
I
it?
tried to put some, maybe aloe vera, some itchy cream.
Okay.
It didn't help much.
It just kind of went away.
It goes away. It's not anything damaging. It doesn't last, but it's... Who wants to experience it?
Right, nobody. Okay, so now I'm going to do an exam on you.
Okay.
So first I'm going to start with your head. I'm just feeling your head, make sure it's symmetrical. No issues with your hair, your scalp. No itching or anything like that, correct?
No.
Okay. Now I'm going to press on your sinuses. Does this feel painful at all?
No, I did just take some sinus pills.
I'm right here.
When I do sometimes my eyeballs feel like,
Like, do they feel
sore.
swollen? Okay.
It's sore.
I'm going to take a look inside. I'm going to look in your sclera and your conjunctiva. Alright, they look clear. Your lacrimal ducts look okay. You said no tearing or anything like that, right?
Tearing, yeah, in the morning.
A little bit? Okay.
When I first get up, it kind of really, I'm like bloated, my eyelids.
Mm-hmm.
Sometimes with
Okay.
sinus.
Now, I want to take a look at your eyes. So, I'm going to take a look. I'm going to flash a light in your eyes. I'm going to check out your pupil reflex. Just look straight ahead for me. Alright, good. So now I'm going to check the consensual side. So when I flash in this on your right eye, I'll watch your left eye. Good. Let me do your other side. Good. Equal reaction on both sides. Now I'm going to do a little bit of a test for your peripheral vision. I'm going to wiggle my fingers. So I'm going to start behind your back, and you let me know when you start seeing my fingers, okay?
Behind your back.
Yeah.
Okay. I do see the one side. Wait.
Look straight ahead.
Okay, look straight ahead.
Yep.
Okay. Okay, I do see the left side.
Okay, I'm going to go from this side.
I see the left. Okay, I see both.
Okay. Now, I want you to follow my fingers, okay? Now I'm looking to make sure that you don't have any nice nystagmus. Yep, just follow my finger. Good. And down. Okay. Now I'm going to go towards your face. And you're going to go a little bit cross-eyed, but just watching your eyes.
Do you want me to tell you when I see double?
Do you see double?
Not yet.
Can you follow my fingers to your nose?
Oh, I do see double.
Okay. Now, next what I would do is with an ophthalmoscope, I would look for your retina. So I'm just going to pretend like I'm doing, okay? So you look straight ahead, and I would be flashing the light into your eye, looking for your optic disc on each side, looking to make sure there's nothing, no opacities, no bleeding, anything like that. So I'd look on the right side, then come over, look straight again, then look to the left side for the same thing, optic disc, look for the retinal vessels, and that is it. Okay, so next, what I want to do is listen, or check your hearing.
Okay.
So, can you cover, okay, with your, yep.
Yeah, cover my left.
Yep, and just like,
Block
block
it.
it, but press it in and out a little bit. I'm going to do a whisper test, so I'm going to whisper 3 things on this side, and you tell me what you hear.
77. 18. Yellow.
Okay, I'm going to come and do that on the other side.
38. Dog.
18.
18.
All right, good. So another hearing test I would do would be to check to make sure you have equal lateralization of hearing. It's called a Weber test, but I don't have all the tools for this. So I would get a tuning fork, strike it, and then place it on the top of your head and ask you whether or not you hear it better on one side or the other. The next test is the ring test, which I would again strike the tuning fork, place it on her mastoid bone back here, ask her to stop, or tell me when she stops hearing it. Then after that, move it to the side and see how the time difference between the air conduction and bone conduction. Next, for the nose, I'm just checking to make sure everything is symmetric here. No drainage on the outside. I'm going to take a look inside. No redness. Nothing looks inflamed. You look equal and symmetric. Thank you. Next, for your mouth, I'm going to have you open your mouth. I'm looking at her soft palate, hard palate. Looking for any lesions, any swelling, redness, bleeding in her buccal mucosa. I'll have you stick your tongue out for me. And can you say ah?
Ah.
Okay, stick it out a little bit more. Thank you. One more time. Say ah. I'm looking for the rising of the uvula with that. Thank you. Next, I'm going to listen, or I'm going to actually feel your lymph nodes here.
Yes, I can.
I'm looking for hard and round. Here. I don't feel anything right there, which is good.
Okay.
Next, I'm going to have you tilt your head back a little bit and feel her trachea. Can you swallow for me? Okay. Next, I'm going to feel her carotid arteries. And
what does that do?
It's just the arteries that are in your neck.
Yeah.
That go up to your brain. I'm just feeling to make sure that you have equal pulses on both sides.
So if they're blocked,
it would. So if it was like more blocked, then I wouldn't feel it as hard. I wouldn't feel it beating as well.
Where did it be?
Yeah, you felt good.
So I'm not black.
No. Next, okay. So I'm going to do a respiratory exam for you. So I'd like you to actually turn to the side if you can for me. Thank you. I'm just going to move this actually. That way I know what I'm looking at here. Okay. Can you turn a little bit more of that? There we go. So first I am just checking her back for symmetry. Does it hurt if I press anywhere?
Nope.
No? Okay. So next I am going to percuss her lung fields. Sorry, I should tell you what I was doing. I'm going to be doing a tapping on your back, okay?
Okay.
I'm listening for the sound that it's making. Alright, everything is resonant, no areas of dullness. Now I'm going to put my hands on your back. I'm going to feel your chest expand, so can you take a deep breath for me? Good. Alright. Next, I'm going to have you say the word 99, and I'm going to put my hands on your back just to feel the vibrations.
99, 99, 99, 99, 99.
Okay, good. I'm going to take a listen to your lungs back here, too. This might be a little bit cold. All right, you take a deep breath for me. Good. Good. Now the other side. All right, good. Your breath sounds are clear. I heard vesicular throughout. The next thing I need to listen to is for you to say 99 again, but while I'm listening with the stethoscope.
99, 99, 99, 99, 99, 99.
Good. No bronchophony. Next, I'm going to have you turn again. Good. So, we'll listen to you on the front.
Okay.
I'm just going to pull this down a little bit.
Okay.
I'll zip it for you. That way
okay.
it stays. Okay. And listen to your breathing again. I'm going to listen up here. Take a deep breath for me. All right. Okay. Bronchial noise on both sides. Good. Clear on both sides.
Any heart murmur?
No, I was just listening to your lungs. I'm going to do the
okay.
heart next.
Okay.
Okay. Next, I'm just going to feel your chest. Feel for any vibrations or thrills. Okay. So now I'd like you to lay down, actually. I'm going to put a pillow back there. Actually, can you lay, sorry, long ways here.
Sideways.
Yeah. Alright, good. So now I'm just going to first have you look over to the left. I'm looking for jugular venous distension. Look over right. Now you can look straight And that is, I'm looking for one of the veins now in your neck. A lot of times, if they're really what's called distended, or like you can really see the outline of the vein, it's a sign of heart failure sometimes, but you were okay.
Oh, okay.
So, I'm going to listen to your heart sounds so you can just breathe normally. First, I'm going to listen for the aortic area. That's a second intercostal space. Listening for S1 and S2. And then over to the pulmonic. Normal S1, S2. Going to Herb's point. I'm going to listen, sorry, go under your bra. Listen to the mitral area. Alright, listen with the diaphragm, now I'll listen with the bell. Listening for murmurs and abnormal sounds. Again, aortic. Yeah, I can hear it. Your heart murmur. It's what it is the sound of the blood hitting the ventricle. So it's like an extra sound that it's hard to describe.
Like an echo, like a
kind of like
sound.
Yep. So next, I am actually going to feel. I'm going to lift your shirt just a little bit. Feel and listen at the pulse, the point of maximal impulse. It's where your heartbeat you can usually feel. Okay. I'm going to have you actually turn a little bit, like on your side. Yeah. Okay. Feel from you laying on your side here. Okay. I'm gonna listen right there. Good. Next, I'll have you lay back again on your back. I'm just going to feel your pulses. I'm going to start with your radial. Good. Here. Good. Go on this side. Everything's feeling strong. No bounding pulses. Not thready either. Good. I'm going to feel a groin pulse. Femoral pulse. Okay, good. I'm going to take a quick look at your legs. No shininess. Good circulation here. Actually, I'm going to take your shoes off, sorry.
Oh, you are?
Yeah, I need to feel the pulses in your ankles.
You need them both, right?
Yeah, and your ankles and feet.
take my socks off too.
Yeah. Sorry, I should have told you before. Okay. Your tibial balls. Dorsalis pedis balls. Alright, good. And that is it, actually.
You mean I'm done?
Yep.
Okay.
Thank you.
Oh, well, thank you.
Been a good patient.
Any problems? Just a murmur?
Yep.
Bitches would probably a problem.
Which you've known you've had.
I was born with it.